Okay, so team, you are welcome to share your screen and we will begin in just a minute just to make sure everyone has had time to come back. But yeah, you can pop your slides up if you would like. Awesome. Give me a few seconds and I'll let you know when to start. Okay, the floor is yours.
Okay. Good morning, judges. We appreciate you taking the time to meet with us today, and we can't wait to tell you about our product, Nova. Over the course of the last 2 weeks, we've been able to conduct research, understand the pressing issues, and develop a thorough solution. Before we begin, we would like to introduce our team. I'm Oliver Poor, a third year at Boston University, studying public relations in our College of Communications.
Hi, everybody. My name is Asha Singh, and I'm a third-year computer science student at Boston University. Thank you.
Hi, I'm Ben Reidler, a junior in the Boston University Questrom School of Business, majoring in business administration and concentrating in finance and strategy. It's a pleasure to meet all of you.
And lastly, I'm Neva Haber, a junior studying neuroscience at Boston University. Thank you guys for being here, and let's get started.
Over the course of the last 21 years of my life, I've spent a lot of quality time with my grandparents. There would never be a time where I would go to my grandparents' home and they wouldn't ask me, Oliver, are you hungry? Oliver, what can I get you to eat? It was a running joke in my family that even if we had eaten before showing up to my grandparents, they would insist on feeding us again. Unfortunately, in 2010, my grandfather passed away and it left a lasting impact on our entire family. He was the one to always encourage us to eat well, exercise, and socialize amongst others. While each of us were affected, there was one person who suffered most, my grandmother. As a widow, my grandmother had no one to cook for, and it led her to beginning to eat less. Instead of waking up and cooking for two, she would sometimes skip meals in order to not feel lonely at the kitchen table, since she would be eating alone. Nobody in my family honestly realized she wasn't eating well or that there was an issue because my grandmother was extremely independent and always refused to see a nutritionist and would avoid seeing doctors. These feelings of loneliness led my grandmother to have an increased risk of malnutrition, and that was a major issue. After realizing this personal problem, we as a team began to interview our grandparents, our friends' grandparents, and others over the age of 65. From here, I'll describe the two personas we were able to develop from our 15 interviews. Firstly, Susan is a 70-year-old woman living alone in a suburban home. She has 3 children, but typically doesn't like to burden them for help because it makes her feel less independent. She believes that nutrition is important and that she should eat healthy, but hasn't ever really been to a nutritionist. Susan tried to change her diet, but after 1 week, she went back to her old ways because the process was too difficult. The only technology Susan has is the iPhone her son got her, but she only knows how to use the call feature. On the other hand, our second person is Jerry, an 80-year-old man living alone in a city apartment. He doesn't really enjoy making food for himself and usually only consumes the frozen food his daughter made for him earlier that week. He's never tracked his food and doesn't think about dietary intake. On his day-to-day, Jerry doesn't have many friends and spends most time alone in his apartment. Even though his daughter got him a smartphone, Jerry has had a difficult time with it and prefers to use the landline to speak with family members and his doctor.
So after speaking with several people and creating the personas, we narrowed down the problem scope to 2 main buckets. One, that many older adults, 65 and over, do not visit a dietitian regularly. And 2, they are less likely to make necessary behavior changes regarding their diet. So to look into this further, we identified 3 main pain points within each of these buckets. So older adults do not visit a dietitian regularly due to there being clinician shortages and the fact that they are not being recommended to see one from their PCP. And there's this overall attitude of not wanting to visit a dietitian because they feel like they don't need to or they don't want to. Looking at the other bucket, as we age, our dietary needs change, and this results in needing to change our own behaviors surrounding our nutrition. However, more older adults are opting to stay at home instead of going to nursing cares. And this makes them more vulnerable to isolation and loneliness. And this makes it more challenging to change their long-lasting behaviors and habits regarding their diet. So combining these two buckets together, we found that older adults are at an increased risk of malnutrition. So keeping the problem statement in mind, we created NOBA, a digital health SAS platform. NOBA leverages the intersection of voice-powered technology and community-based accountability to really connect and engage peers as an instrument to influence their nutrition-based behavior. And this is for the older adult population between ages 65 and 80. So let's talk about NOBA's features. Since touch-based technology is a barrier within the 65 to 80 age group, NOBA is voice-powered only, and this allows for an easier learning curve and implementation. And it allows users like Jerry and Susan to feel much more comfortable using the technology. Research studies also show that social support, whether it's actual or perceived, is key to trying and sustaining behavioral changes. So having just a voice-powered system is simply not enough. NOBA integrates community accountability by connecting community members together and encouraging healthy competition among them. And by leveraging the social support system, NOBA gives the tools back in the user's hands and gives them the tools to make and sustain their diet-related behavior changes. And NOBA facilitates healthy eating by sending meal reminders, food tracking features, producing analyzed reports, and awarding the user's weekly health scores. NOBA is homemade friendly, and because it promotes independence, it also allows caregivers and family members to stay informed with what is going on with their loved ones regarding their nutrition. Additionally, research shows that a healthy diet can slow the cognitive decline and improve overall health. So by promoting positive diet changes, NOBA in itself is promoting food as preventative medicine, resulting in better health outcomes overall. And lastly, as I mentioned before, older adults living at home are more vulnerable to isolation and loneliness. We know this. And so NOBA allows users to connect amongst each other within their own communities by features of an intercom and recipe sharing. So now Asha is going to take us through some of the market research interviews we've conducted.
We first spoke to religious organizations. They all let us know that most of their income is self-funded, but that funding can be $50 to $5,000 or more per month for members that they can spend on quality assistance for their people. They told us that they love the food and specifically the community aspects and are definitely willing to try out a service like this. We then spoke to some cultural organizations, and they said that they had even more funding than the religious ones. They loved the product and that pricing was not as much of a concern. Through speaking with these organizations, we really saw them as a key distribution point where families were willing and would be able to purchase the software for their loved ones.
We sell NOBA by partnering with community centers. Through this model, we're able to best ensure that the 65+ community is effectively shown how to use the product and is correctly trained for long-term success. By having our customer service representatives work with community volunteers and staff, we can help our consumers have a seamless onboarding process for the software. Community centers such as religious institutions and senior care facilities will pay us for the service themselves, and we'll be able to distribute it to their 65 and over community members with the help of these volunteers and NOBA members. From there, our consumers can then choose to use our service for a monthly subscription fee, which will include continued support for the product. In addition, we will have the option of distributing the software to family members directly, so they can help their 65 and over relatives with the entire process. This will work alongside issues such as organizations that cannot always afford to buy this service up front.
Looking into our market segmentation, as for our total addressable market, we started with the number of people over the age of 65 in the US, 47.8 million, and we researched the number of religious organizations and senior centers in the US, which is 203,000. For a serviceable available market, we determined that the number of 65 plus who attend religious services at least once a week and the number of people who go to the senior centers every year would be the people who are the most involved with their organization, and they're the ones who would potentially receive this product. And then for our serviceable obtainable market, we are assuming that we are going to be capturing 15% of the market, which is going to be 3.6 million people. After conducting our market research, we found 4 companies that have some of the key features that we were focusing on, and they would be the closest competitors for Nova. We are the only product on this market that has all 5: community engagement, voice-powered, food tracking, affordability, and HIPAA compliance. Based on our value proposition, community engagement is the feature that is most important to us, so we are going to be focusing on Mon-Ami and INF Care specifically. Mon-Ami and INF Care both offer community engagement, but Mon-Ami does not offer the option to use voice commands, and being a voice-powered product is a key feature that makes us more accessible to the older population. INF Care is voice-powered and has community engagement, but they and Mon-Ami are both not HIPAA compliant, and HIPAA compliance is a large regulatory concern for us since we really want to be protecting our users' privacy.
Our revenues for the upcoming year are projected to be $350 million, based on the assumption of capturing 15% of our total addressable market of seniors that attend senior centers or religious organizations. Our costs are mainly consisting of hosting, maintenance, and iterations to our software, costing roughly $50 million a year. Our SG&A is allocated towards administrative salaries and heavily weighted on both the marketing expenses and our sales force. This is our biggest expense, coming in at around $70 million for the first year. This is because it is crucial for staff to be on site and help set up Nova software, as well as having a strong marketing team to make sure that these organizations are even aware of the services that we have to offer. This leaves us with a net income of $181 million in the upcoming year. We then based our next 2-year projections on the current growth rate of the 65 and over population and increased awareness of our product among the target organizations.
Looking towards the future, our goal is to expand our product and to see plenty of growth. We would like to upgrade our software and place add-ons such as personalized recommendations from a nutritionist, expanded language options, and a screen option for the deaf community. In addition, we would like to partner with grocery stores to create a food delivery service for our 65+ community members. Our goal is also to create nutrition clubs for other groups. An example of this would be teenagers with diabetes. Additionally, we would like to commercialize Nova for increased adoption. We have a lengthy futuristic plan, but we completely believe that Nova will be a necessity in homes across the nation.
We would like to say a special thank you to the mentors that have worked with us throughout this amazing process. We would also love to say thank you for the organizations that helped us drive key insights. And lastly, we want to thank you, the judges, for giving us your time, and we now open the floor to any questions you might have about Nova.
It was a great presentation, and I really love the fact that you actually went out and talked to seniors. I think that's a critical part of developing anything that our seniors are going to use. So bravo to that. Can you talk a little bit more? You talked about a monthly subscription fee, but you didn't talk about what the price point that you expect it to be.
Yeah, so the price of the initial software purchase is $50, which we're expecting to be covered by these organizations as the one-time installation fee. And then the monthly subscription is $5 a month, which is the price point that we found would be the most beneficial to the 65 and over community that might not have this additional income to spend, but would also allow us to pay for upkeep, iterations to the software, and this whole storage of their data.
Great, thank you. And I also really like the fact that you thought about the future, because there are other groups, like you said, diabetic children with diabetes and things like that I think could use this. Could you just, one more question if I might, is this integrated into like an existing Alexa or something, or how do you plan for the software to be there?
Yeah, so how this works is it's an add-on for products such as an Alexa or a Google Home. It's if you're familiar with like the skills feature on the Alexa, so it would be like an add-on to those existing devices that are already there in the market.
Thank you.
I had one question. I love the idea. I think it was a great presentation, and I love that it's community-based as opposed to kind of medical home-based. I mean, I really appreciate the senior center and church religious institution aspect of it. I think that's really innovative and thoughtful. I'm curious if you can say a little bit more about the community accountability, like what that looks like and how that would be developed.
Yeah, so I guess I could answer that question. So for community accountability, we really wanted to create a support system that would really encourage these behavior changes. So on a weekly level, each user will get a healthy score index that's only relevant to their own journey with their nutrition, because one diet for one person isn't going to necessarily be the same as for another person, and we acknowledge that after speaking to a few RNs and dietitians. So essentially, each person will have this healthy score weekly, and we will use these numbers as kind of competition among the other members, but still within themselves. So for example, let's say Jerry and Susan, right? We love Jerry and Susan. If Jerry's healthy index score for the week is 7 out of 10 and Susan's is 5 out of 10, Nobo will tell Susan, hey, Jerry scored a 7 out of 10 this week. How about you how about you also try to increase your healthy index score? And then they'll be more likely to willing to try to increase the score by eating better foods that aligns with their diet. And then through the food logging, NOBA will understand this and then, increase their food score. And so by having this competition, it also gives you some sort of accountability to also kind of want to and motivate yourself and others to kind of continue maintaining and increasing your score.
And no matter what your age is, everyone loves a good, healthy competition.
And it's a healthy competition because it's good competition and it's for your nutrition. So, yeah.
Great. Thank you.
Of course.
Thank you so much again for the nice presentation. I agree with Elizabeth. I love the community aspect, but also the voice aspect that you've chosen. Very cognizant of the senior community in that regards. I think one of the questions I'm trying to, again, visualize how this works in terms of helping the seniors with the nutrition aspects. Like, I know you talked about various features, but is it possible for you to walk me through, in terms of, is it going to ask them questions? Is it going to give them suggestions on recipes? I'm trying to mix how the different features work in a patient journey or a senior journey perspective.
Yeah, so I can start this and then another member could continue it if they have something to add. So essentially, as of right now, the first kind of product that we're giving out doesn't make necessarily specific nutrition recommendations, because if we did that, then we would have to have dietitians and registered nutritionists on our staff kind of mitigating that. So that is definitely our future goal. But as of right now, with what we have, essentially NOBA will kind of remind the users to eat breakfast, eat lunch, eat dinner, kind of getting them thinking about it. And after each meal, NOBA will ask, okay, so what did you eat? And Susan will be like, oh, I had some Brussels sprouts and pasta. And NOBA will say, okay, how big was it? Was it the size of a tennis ball, the size of your hand, to also gauge, the actual serving size of what they're eating. And it's through this voice interaction that they're getting reminded to eat, and they're also updating the NOBA what they're eating specifically. And then comes in the community engagement, right? There's specific features that allows them to share recipes. So if NOBA says, okay, eat lunch, Susan could say, okay, are there any shared recipes? And it could be like, Jerry 20 minutes ago shared this recipe. And so they can interact with each other through NOBA to kind of promote that. And then at the end of each week, they have this healthy index score that I was previously talking about based on their own nutritional journey. And so the whole idea is just to constantly get them encouraged and promote, this behavior change, and to promote eating well and still connect one another other members within the same community. So if someone else wants to,
yeah, of course. And
but
I think that really, this initial feature of the food reminders was crucial due to the interviews we had with our grandparents, our friends' grandparents, and just like people over the age of 65. We were able to notice that the people over the age of 65 it's not like they don't want to eat, it's that sometimes they just forget to eat. And I can tell you my grandparents fell into that model as well. So these daily reminders of have you eaten breakfast yet? And it's a very simple question, but it can also help remind someone to eat and to stay updated with their meals.
Thank you.
Hey, I just wanted to thank you again for a great presentation. I think that the combination of having the technology meeting with what the needs are for the seniors is great. I'm curious what your thoughts are on what this product could really do in the future. Like if you're looking down 5 years down the road from a business strategy of where you see this.
Yeah, I think there's plenty of room for growth. Our initial stage right now is reaching the people over to the age of 65, but isolation, especially due to COVID, has now become a large issue, and it affects people's mental health regardless of age. I think looking down the line, we could clearly see the vaccine has been rolling out, but things like work from home is still going to be an aspect that I think will still be around in years to come. So this voice powered community feature I think can be utilized across any age, as we mentioned, teenagers with diabetes. I have a good friend whose brother is unfortunately autistic, and due to COVID, his mental health is extremely deteriorating due to the fact that he can't hang out with his friends. So this voice powered thing can be something that is utilized across any single healthcare issue, and I think that that's the room for growth, is that once we reach that 65 and older, we're going to look to reach any demographic across the nation.
And just to add on that, I think Oliver kind of described it perfectly, but I think there's also great potential for research here, kind of showing that NOVA's actually benefiting, maybe really is a preventative medicine, really showing that health outcomes are improving by using NOVA. And through that, we know as of right now, the older generation isn't used to seeing nutritionists. I think that's much more of a, not newer, but millennial Gen Z kind of generation of, okay, let's go see a nutritionist. That's not in the mentality of the older communities. So preventative medicine is key. So we could be integrating NOVA within this area of preventative medicine and kind of integrate it within a nutritional system. And that could also hopefully alleviate some clinician shortages that is in this area. And so ideally, if you could have this platform that registered dietitians and registered nutritionists are kind of giving out to their clients regardless of age, but kind of grouping them by groups, that could really be the future of nutrition-based medicine. And I think that preventative medicine is a really big focus nowadays within the healthcare industry. Costs are rising, and by focusing on preventative, we could hopefully, overcome that. So, yeah.
Great, thank you.
Awesome. We have time for any last minute questions if anyone has. Okay, if not, you guys can stick around for another 2 minutes just so we can make sure anyone has their last questions. And besides that, we are having a networking event from 1 p.m. with a bunch of our sponsors and collaborators. We'd love to, it'll be like a breakout situation so you can really get to know the other participants as well. Other notes and boards at 1 p.m. So we hope to see you back. If nobody has any other questions, you are free to go. Thank you so much.
Thank you, judges. Have a great
Thank
day.
you.
Happy holidays for whoever's celebrating.
Thank you.
Bye.
Bye.
Bye bye.